Hello, and welcome to Town and Country Compounding, the podcast where we spotlight innovation, passion, and the incredible people who make a difference in healthcare. I'm Steve, the Director of Strategic Partnerships here at Town and Country Compounding. Thank you for joining us for another episode of our interview series, where we shine a light on professionals who are redefining what it means to deliver exceptional care. Today, I have the distinct pleasure of introducing someone who's making waves in integrative and functional medicine, Dr. Morrison of the Morrison Center in New York City. Dr. Morrison and his team have built an extraordinary reputation for combining the latest advancements in conventional Western medicine with time-tested natural remedies of complementary medicine. Their approach achieves what so many of us in healthcare strive for: optimal outcomes for their patients. Let me tell you a bit more about the Morrison Center. This center is a hub for integrative healthcare. From the very first visit, patients receive a holistic approach to their health. They start with a detailed medical history, a physical examination, and tests designed to create a personalized treatment plan. The care extends beyond the visit, incorporating nutritional guidance and even IV therapies tailored to the unique needs of each individual. Dr. Morrison's philosophy, as he puts it, is, "We believe the body has an innate ability to heal itself, and everything we do is to enhance that process." His work epitomizes the concept of integrative medicine, which treats the whole person: body, mind, spirit, and environment. By addressing the underlying causes of disease through a systems-oriented approach, his team enables the body's innate ability to heal itself. Beyond integrative and functional medicine, the Morrison Center is also at the forefront of environmental medicine. Dr. Morrison's innovative detoxification protocols combat the chemical pollutants we encounter daily, an ever-growing challenge in our modern world. Dr. Morrison, thank you so much for joining us today. It's truly an honor to have you on the show.
Thank you, Steve. It's great to be here.
Yeah.
And we've gotten to know each other a little bit over the last few months.
Yeah, we went to Boston, and somehow there was a portal to Vegas. Wasn't that weird?
I didn't realize that Boston had a casino,
Yeah.
but here we were.
Yeah.
It was a great venue for a great lecture conference.
Yep.
And John Herr was speaking there. He had a great presentation about the benefits of compounding pharmacy.
Yep.
And I loved his talk, and I presented on chelation therapy for cardiovascular disease and detoxification.
Yeah.
And then we had a great after talk.
Yeah.
A round table.
Yep.
Which was around dinner.
Yeah. It was a great dinner. Great dinner.
Yep.
From your talk, I remember you honing in on ceramic cups and how a lot of them had lead in them, which is like one of these surprising, like, wow, one of your coffee mug in the morning could be giving you lead poisoning, which would cause you so many of your problems.
Yeah, and it's from the glaze from those ceramic cups. So we very often check blood, lead, and mercury levels for our patients if they're having fatigue or difficulty concentrating or just for preventative purposes. And if we see a lead level above 2, then we are trying to find where the source of exposure is, because a person should not have lead in their blood.
Yep.
Unless there's exposure. So yeah, we've had a number of people who've bought glazed plates or mugs on vacations or for their home use.
Yep.
Or their children made it for them at art shop.
Oh my God. That's so sad. That's so but that's so tragic, right? Because it's like a present from your child or grandchild, and they're causing you lead poisoning.
It's probably much better on the shelf for display purposes.
Yeah.
But do lead test strips, and then you can check, and then a person can know.
A more common thing I was thinking from your talk also with aluminum, I texted you about this, is Nespresso pods. They're made from aluminum.
Great point. Yeah, those Nespresso pods. So coffee is acidic.
Yep.
And water has to go through it.
Perfect for leaching aluminum.
Great. Exactly.
And how many of us are millions of people are having these Nespresso pods multiple times per day? Me personally, in our pharmacy, we have an espresso machine.
I mean, I don't know which is worse, the aluminum or the plastic. So
right, because the curing is plastic. Yeah, exactly. Yeah, it's crazy, and I like that. So in your book, Cleanse Your Body, Clear Your Mind, there was like a nice don't be afraid, because from this book you can become so paranoid of the world is killing you, but information is power.
Yeah, we believe that the body has an innate ability to heal and detoxify itself. So ultimately, we want to know if there are sources of exposure because we want to eliminate those if we're going to have success. Particularly nowadays, we're seeing so many people with mold exposure from water damage in their homes or the bathrooms. Uh, so anyway, we look to find where their sources of exposures are, eliminate those, and then improve the detoxification process.
I had like an article on LinkedIn about bath toys for babies because, I have a 3-year-old. So over the past 3 years, we've definitely spent a lot of time with bath toys and baths. And it took me, it took me quite a while to discover that like the rubber ducky has like mold in it.
I know it is.
Now, so many of those bath toys, they're designed with holes.
Yep.
Water gets in, it grows mold, and these are your babies.
Yep. Yep.
So like I'm always like finding it and I'm like, this is crazy that like if I didn't discover this,
And then the babies are always putting it in.
they're putting it in the mouth. Always.
We figured out the same thing with our children too.
Yeah. I mean, yeah, it's crazy. So okay, so assuming someone changes their body, they do everything, lifestyles, all that stuff, there's still a place for medication. So I want to kind of hone in on that. So first are the
Well,
yeah,
so and I will even add to that. Yes, it is true. Our goal is to help the body to work as best as it can. Now, there are certain circumstances when a person is too sick and they need to have additional therapeutic support.
right.
Definitely vitamins, minerals, supplements, herbs, they have a role and they work. But sometimes a person really needs something that's stronger.
Right.
And that's, thank God for conventional medicine because there are actually prescription medications that have quite a beneficial benefit with pretty low side effect risks.
Yep.
And when it's necessary, it can be really life changing for people.
Actually, before I ask those questions, let's zoom out a little bit. What is I get from interviewing, talking to so many doctors like you, I see such a very big difference from your standard doctors. And I left traditional pharmacy a while ago. I worked at CVS, Rite Aid, Walgreens, and I saw that we were just dispensing almost felt like toxins and enablers for patients just to like have bad behavior. What's the thing that traditional healthcare is missing? Like your standard doctor, not to blame them for anything, but what are they missing?
Well, so conventional medicine is fantastic, especially for acute situations like traumas, injuries. That's where it becomes a miracle. Bypass surgery, amazing.
Even cancer.
Frick, apps, 1,000%.
Yep.
However, lifestyle diseases like diabetes and blood pressure and heart disease or high cholesterol, uh, uh, the medications that are made for these things are meant to block some kind of process, like antihypertensive, anti-diabetic drug. They're usually blocking some kind of process, and thereby that is where the toxicity comes from. So blood pressure lowering medicine is calcium channel blockers or beta blockers. So what our goal is to try to figure out why a person is having those issues. And very often we start with like the diet and exercise and lifestyle, and then sometimes supplements. And yes, sometimes people need to have prescription medications. But when we're choosing prescription medications, we're usually trying to find ones that help to improve how the body works.
Right. Kind of more upstream.
Well,
Than band-aids.
and so that's exactly where there's so much benefit that has come from the recent developments in research on these glucagon-like peptides, which are peptides and by the way, our body makes peptides. That's in fact our body makes glucagon.
Oh yeah.
And it's a glucagon-like peptide.
Yep.
So that's what's kind of unique about that class of medications, which I think is worth us having a conversation about, because glucagon-like peptides help when a person has a broken metabolism, which means they're so insulin resistant that their body does not respond to sugar the way that it's supposed to. Hence, so many postmenopausal women are surprised when they start having significant weight gain when they are eating the exact same way they've always eaten, still work out the way that they've always eaten, but they just can't keep the weight off their midsection and their hips and thighs. This is a very well known effect from insulin resistance, which becomes worse
Mhm.
with a lack of estrogen. So that's when it's revealed that the insulin resistance is an issue, which is a metabolic defect. And of course, definitely start with lower carbohydrate diet. Definitely try to do more aerobic training. But if those methods are not working, there are other ways to improve it. And by the way, I will also say, I really think that a lot of the reason that we're in this situation is because of the toxicities that's been introduced into our environment from plastics, pesticides, and preservatives,
Yeah.
which are basically from the foods that we're eating, or for those little plastic ducks that our babies were eating, chewing on. We all were when we were kids. Those are plastics that have plasticizers that are endocrine disruptors that are chemicals, forever chemicals, and they are known to interfere with proper cell mechanisms, including insulin sensitivity.
Yeah, so it's like an interesting mix because you have to like convince the patient, get them to do the right things, but sometimes you need this extra help, like GLP-1 semaglutide, tirzepatide. So, how do compounds of GLP-1 receptor agonists, GLP-1s, enhance patient outcomes compared to commercial available versions? And what unique formulations have you found most effective in your practice?
So, you again, it's amazing this peptide that was developed because truly it gets at the heart of people's metabolic dysfunction, which is helping to eventually improve the insulin sensitivity. It also has an impact on slowing the absorption of carbohydrates into from the digestive tract, which also delays the release of insulin. So it helps to make a person more insulin, I guess,
Sensitive. Yeah.
Uh, so,
Who would have thought being sensitive would be good?
well, your lipo always told you that,
That's right.
and mine did too, and we're better people for it.
That's right.
So, for when it comes to insulin sensitivity, using GLP-1s by the prescriptions, the Ozempic and Mounjaro, they work, but sometimes they do have some pretty significant side effects if it's too much too quickly. Even the lowest starting dose for some people can bring on the side effects, which could be like nausea or now, of course, that's partly how it works. It helps to decrease appetite. But if it's too strong of a signal, right, a person will feel nauseous. Right. And that's where compounding pharmacies really shine because a doctor who has some experience using prescriptions can think to themselves, well, is this person more sensitive? Do we need to start at a lower dose?
So go pretty much as low as you can possibly draw it up.
Yeah.
Microdosing.
Well, and hence that's exactly what we do for a lot of patients is we microdose the semaglutide, the tirzepatide. I never know exactly which is the perfect one for people. I have different favorites at different times, but generally they both work very well. And in fact, sometimes I'll go back and forth depending on what a patient's how their success is being achieved.
Yeah, the latest microdosing GLP-1s is like really booming. We're getting a lot of interest from providers, and I got to the point where I'm using it for dandruff because dandruff is autoimmune, relatively speaking.
Yeah.
So I've noticed that it helped me, and it's pretty amazing if you look at overall how many conditions fall under that autoimmune blanket. Um, and when I'm using it, I'm not itching as
So
much.
what do you consider a microdose? I'm curious.
Yeah, that's a good question. So it's about a quarter to a half of the lowest doses.
And that's basically what we're using.
I mean, you don't have to go super crazy up and down, but you're gonna set it. Yeah.
For the semaglutide, it might be starting at, instead of 0.25, you're starting at 0.1,
Yep.
0.2.
Yep.
And for tirzepatide, it could be starting at 1 or 1.5. Yeah. And yet we've also noticed that people can get an anti-inflammatory benefit from that for like unexpected benefits for people with like chronic achiness from Lyme disease. We've seen it have an impact. Or also, I think that there's enough suspected benefits that it can help with blood sugar regulation for people that have cancering processes or susceptible. Yeah, obviously that's not that's off label, but it can be beneficial. And then of course there's no question it helps so much for the weight loss benefits.
Yeah.
It I go like, right now when you have like a overweight and obesity rate in the country, that's like 50 to 75% of Americans. It's remarkable. And again, that goes back to how did that happen? Well, part of it's the processed foods that a lot of people are eating. And then also the pesticides, plastics, and preservatives, which then are the endocrine disruptors, which cause the worsening insulin resistance. And then the GLP-1s help to come in to decrease the inflammation, improve blood sugar regulation. So people have less cravings. They have appetites under control, which means better focus, better concentration. They're more productive.
Even social media addiction, some people have found when they're using GLP-1s that aren't as forced or feel so compelled to doom scroll
Yep.
or any kind of other addictions. It doesn't have to be just
Well, less alcohol consumption, less cannabis consumption.
Yep.
Really that blood sugar fluctuation affects people in so many unwanted ways.
some of the talk is also in regards to these peptides like GLP-1s is this like cycling of peptides. So, and which is nice because people don't want to hear that they're on the same medication for the rest of their life. So Sermorelin is another peptide that's not as popular, but it's like a pretty cool like sidekick to the GLP-1s because the GLP-1s do cause weight loss, but often cause muscle loss, stomach issues, and Sermorelin actually helps with muscle gain, muscle rejuvenation. So, how do you use it in your practice? How do you use it with GLP-1s, without GLP-1s? How does Sermorelin basically factor into your care?
Well, remember, when a person's on a GLP-1, we'll definitely make sure they're on a high protein diet. They cannot skimp on that, but they'll cut back on carbs. And then with Sermorelin, which is a growth hormone releasing hormone, basically we know that growth hormone has a lot of benefits. There are ways that the body can make growth hormone on its own, like if a person is in a fasted state before they work out, or if they're getting the deep restorative sleep, their body's producing growth hormone better. But as we get older, we're just not making as much as we used to. And hence, that's part of the reason why people think that they're getting sarcopenia, which is the loss of muscle mass as they get older. So things like Sermorelin is very useful to take 5 days a week at night on an empty stomach.
Yep.
Which then helps the body to naturally produce growth hormone in a pulsatile fashion before they go to sleep. And just like you were suggesting, the benefits of that growth hormone surge is to improve the signal to make muscle
Yep.
and to burn fat.
Yep.
So yes, you're right. Those two work together very well.
Yeah, it's amazing. And like the cycling of it, doing going on and off of these. And I mean, ideally you want patients to the point where they've adjusted their lifestyle that they don't need these peptides, that they're naturally producing it from lifting, proper diet. So it's kind of like this like push in the right direction.
Yeah, it enhances a healthy lifestyle and diet. A person has to do the diet with this in order to get the best results, and couple that with some exercise, which could be 4 times a week for 40 minutes of some kind of resistance training. And if a person is unsure of how to get started, they should work with a trainer or one of the local gyms. There's lots of ways to get started with that. Even, by the way, walking can be great after dinner as a good start.
Oh yeah.
That combo GLP-1 and Sermorelin is really quite potent.
Yeah. Yesterday was my weekly like Torah Bible study day with my mom. And I this time changed it up and I was like, why don't we go to the gym and lift a little bit? So we did a little Torah study, a little lifting, a little walking, and it's with my mom. So who else to better spend my time with doing that, right?
Well, it's a
Well, maybe my wife and my daughter will be up there, but
wonderful. Yeah, you guys spend time with mom. That's one of the most wonderful things.
yeah, that's cool too. But mom, yeah, mom was definitely,
And we owe them a lot.
yeah. So another compound that is also not really known about too much, methylene blue. So it's like a non-dye dye, one of those kind of like things that like most pharmacists and doctors don't know about. So, and it's gained attention for its potential cognitive mitochondrial benefits. And I know you use it in different doses for different purposes. How do you incorporate into treatment plans, uh, clinical outcomes that you've observed with methylene blue, with detox, just overall, how do you use it in your practice?
So we have been using Methylene Blue for a couple years now, and it is interesting. It is blue, by the way, just like it says.
Yeah.
And if you definitely don't want to get it on your clothes because it will dye it blue.
Yeah.
But uh, when you taking low doses really works like an antioxidant.
Right.
And so that a low dose might be 10 milligrams twice a day. That's pretty low dose, and it's safe. When you start going up on the dose, that's when you start getting into more therapeutic benefits. So at like 25 milligrams twice a day, just as an example, it could have more cognitive benefits like better focus, better concentration. And again, it's partly because of the antioxidant benefits, but also there seems to be neurocognitive enhancing effects. And then if a person wants to go even higher, 50 milligrams twice a day, that's when it can have some antimicrobial benefits.
Yep.
And that's where, in fact, actually, Methylene Blue was the first, like a very early prescription medicine for for malaria. I'm sorry, for malaria. We're using it now for Babesia and Bartonella, where it's been found to have antimicrobial effects and also antibiofilm benefits. So the one thing that a person should know is that the higher the dose, the more possibility there is for side effects with other medications, drug interactions. And it has really to do with one of the suspected mechanisms of action, which is that it can, at high doses, work almost like an MAOI, a monoamine oxidase inhibitor, which is why it can have some mood elevating benefits too.
Interesting. That's interesting. Got it. So for your patients, you see this like varied approach. Same thing, I guess, with the GLP-1s at the low dose, at the high dose, you see different things. LDN, same thing, LDN, and at the low dose naltrexone, at the low dose and the high dose, different purposes. So it's pretty cool that you use that in different ways. Um,
Well, we love LDN too, to tell you the truth. Again,
oh yeah,
repurposed drug.
yeah,
Naltrexone basically is like an opiate blocker. So, but at low doses of naltrexone, it very mildly blocks opiate receptors, tricking the body into trying to produce more endorphins.
Mhm.
I explain it in my mind that when the body's producing more endorphins, the body's happy, and so the immune system's happy too, and it helps to regulate the immune system. So it can often be used for autoimmune conditions like Crohn's, ulcerative colitis,
yeah.
even rheumatoid arthritis and other autoimmune conditions. It's not perfect. It doesn't work for everybody, but it's worth. Oh, and also chronic pain.
Yeah.
It can be really quite powerful for that, but you have to start even lower, like lower doses.
Yeah, and make sure they're not on an opiate.
And definitely not.
But I made that mistake one time with a patient, kind of not like mistake, but more like they weren't counseled properly by the doctor. There was a miscommunication. Well, withdrawal.
But the LDN, frankly, on the website, they're even now suspecting that the low doses that are being used for LDN are not, it's not an extreme contraindication.
Right. It's not instant withdrawal.
Exactly.
Yeah, the patient might have had instant withdrawal. Yeah, he was not very happy. But this was like years ago and stuff. It's just interesting because you're playing in this field. Low dose naltrexone is not something your standard doctor is going to prescribe, and it boggles my mind how pharma hasn't jumped on LDN bandwagon. It's like,
Well, I think it's our, I don't think that there's a patent on the prescription anymore. So which pharmaceutical company is going to benefit from pushing this?
yeah,
Right? There's like a marketing effort. There's money that goes behind it, and they should hope to make a profit.
yeah,
So the good news is it's relatively inexpensive.
yeah,
And uh, it's when it works, it can be quite life-changing as a anti-inflammatory product.
right.
So it should be something that people should bring up with their doctors when there's inflammation without knowing what the cause is. And this could work like for Lyme disease or arthritis or, autoimmune conditions.
Got it. Now, a popular topic is BHRT, or Bioidentical Hormone Replacement Therapy. So it's a little bit controversial, especially when you're speaking to OBGYNs, which would make sense for them to prescribe this for women. Uh, but it's a little bit controversial. Like ACOG pretty much denounces BHRT, right? And w- why is that happening? how are you seeing the benefits for your patients? And again, at a global level, it's like crazy, like why at this high level things are like shut down, but at this like almost like grassroots level, all these doctors are helping their patients and they're feeling so great. So what's going on?
Well, I think this all started probably 15 years ago when the Women's Health Initiative came out, and that suggested that taking hormone replacement therapy was associated with increased risk for breast cancer and ovarian cancer. Now, what they realized in that study was it was really very specifically the progestin from Provera, which increased that risk.
Right.
Uh, so when we're talking about bioidentical hormone replacement therapy, we're talking about estradiol, estriol, E2, E3, bioidentical progesterone, testosterone,
Yep.
maybe DHEA. So those hormones are just like what our body makes, and there's never been a study to suggest that that causes cancer.
Right.
Now, of course, if a person has an estrogen-related cancer, then they should not be used.
Right.
But I find that in New York City, there's a lot of doctors, gynecologists, that are going to hormone replacement therapy nowadays, bioidentical. And the beauty of compounded bioidentical hormone replacement therapy is the ability to titrate it specifically for what a person needs.
Right.
In the beginning of this conversation, we were talking about what happens to postmenopausal women when they lose estrogen and they become severely estrogen insulin resistant.
Yep.
So the benefits of estrogen and progesterone and testosterone is uh, better brain clarity, of course, less hot flashes and night sweats, uh, improved skin, hair, nails, libido, deeper sleep.
Hmm.
So there's a lot of benefits that I think people would like to have in their lives. So better mood, and probably also better insulin sensitivity. So I guess it comes full circle. We got to look at the whole thing.
Yep.
But the benefit of doing bioidentical hormones is the individualization, and that's what we practice today.
Yep.
It's practicing for the person,
Yep.
patient.
And there's some evidence, and there's some doctors out there that are using it even earlier than menopause and perimenopause, because some people have hormonal dysfunction even in their 30s, right?
It is true, and we can,
Especially in a high stress environment, high cortisol.
yeah, hey, we work in New York City. We are seeing those patients all the time. It's not getting enough sleep, not recovering properly. The stress from the work-life balance. And when we do their hormone levels, we're seeing like either cortisol very high or very low,
Mm,
the burned out.
yeah.
And then even seeing testosterone levels very low in 30-year-olds, as you suggested.
Yep.
My goal is not to give 30-year-olds testosterone if I don't have to, but
Sure.
at least help to get their body to restore itself.
Yeah.
And that there's ways to do that.
Yeah. Yeah. It's amazing because, like, I just, well, some of the biggest pleasure of like working at Town and Country compounding is you get to meet all these doctors and organizations that are doing things differently than the status quo. And something definitely needs to change. It's not like going in the right direction. Patients' outcomes are not getting better. We're spending more and more money. People are like life expectancy actually decreased, several times over the past few years. I mean, COVID didn't help, but it is nice to be partnered with organizations like the Morrison Center that are thinking about it differently, empowering the patient and putting them on the path to better health.
Yeah, and then I would say that just the same way, it's very important for us to partner with compounding pharmacies where we know that they have a very clean and professional standards for which they make the medication. So we know what we're ordering is going into the product. Patients can be comfortable with that. And we know that you and all the pharmacists and John Herr spend so much meticulous time getting it right. And our patients tell us, and that's why we keep on using you because they're happy. And of course, if our patients are happy, we're thrilled. And that's why it's a great working relationship.
Yeah, it's a good match. And like coming here and coming to a lot of the offices, it feels like coming to the pharmacy. It's like a nice vibe. There was another doctor's office that I visited in New Jersey, and they had a patio center outside and like a patio table. And we have a patio table and similar like supplements and stuff like that. And that's the nice thing about working with people of like minded philosophy in the medical space.
So we certainly believe we're going to have many more patients to share together, but also even more important is we keep on learning from each other.
Yes,
So
absolutely.
we appreciate the education you bring to us, and then also, of course, the patients teach us all the time.
Yep.
And we all keep on getting better together to use, when appropriate, the right prescriptions and the right lifestyle, and then we make a better plan.
That's right. That's right. Well, thank you for being on our podcast, and we're looking forward to growing together and making people healthier.
Yeah, thank you, and we agree. We're gonna all be okay.
Absolutely.